Hey guys, it's Sarah here. In this video, I'm going to be going over the pediatric portion of the NCLEX-RN. If you want this video and everything that's on here in a PDF form, please visit my website, www.sararn.com. And you can look at the link below and it'll have the website also. So let's get started. So before I go on to the first slide, I just want to say a small thing. So for pediatrics, we're talking about from birth to 18 years old. So obviously someone who's like 16, 17, 18 is gonna more like be and appear like an adult versus like a baby or a toddler and stuff like that. So with kids, so we're not really talking about like 17 and 18-year-olds and 16-year-olds, but with kids in general, people who look like kids, people who are younger kids, they decompensate very fast. So you'll see like baby's fine, and all of a sudden fever, and then bam, everything just goes downhill from there. As opposed to someone who's older, they could go for a longer period of time and compensate. So that's why like a lot of things with kids are you want to get treated right away and not take it lightly or see like, oh, let's wait and watch. Okay, so let's get started. So growth and development. Over here, there's a chart. It's basically, you see I go from 2 months, 4, 6, and all the way to 3 years old. And it's basically just memorizing what babies are supposed to do. Because when they come for their well checkup at 6 months, 4 months, etc., you have to know if they're up to date or if they're behind. So I wouldn't necessarily memorize all of them. I try to put in the ones that are pretty common, but I would know like, like the major milestones, when people say, oh, does your baby crawl? Does your baby sit? Those are like major ones. So I would know pretty much those, like, for instance, when they raise their head, when they sit up, when they crawl, when they walk, like that. Okay. So the question is, a clinic nurse assesses the communication pattern of a 5-month infant. The nurse determines that the infant is demonstrating the highest level of developmental achievement expected if the infant could walk. So basically it's asking you what's a normal thing that a 5-month-old should be up to. So use a simple word such as mama, uses monosyllabic babbling, links syllabuses together, and coos when comforted. So if you have children or you're around nieces and nephews, stuff like that, it's easier to know, but otherwise, like I just said, I would just memorize the milestones, 6 months, 4 months, and if you memorize 4 months they do this, 6 months they do this, then 5 months is pretty much in between that. So the answer is B. So between the ages of 3 to 6 months, they're supposed to use monosyllabic babbling. When they say mama, that's between 9 and 12 months. Linking syllabuses together is 6 and 9, and cooing is at birth until 2 months. Okay, so now we got past that. So here's just other growth and development when it comes to babies that you should know, or toddlers. So the baby's first food should be given between 4 to 6 months. You want to start at giving like iron fortified cereal. And the main thing with the baby's first food that you want to know is that you want to wait between 5 to 7 days in between food. And the reason why this is because you want to see their reaction, if it causes either they're allergic to it or even just like side effects like constipation. Like you're not going to know which food is causing which if you just keep giving the foods. So and one more thing about baby's food is that cow's milk is not given until after 1 year old. The first dental visit should be within 6 months of the first tooth or by the first birthday. Bladder and bowel control, so that's usually at 24 months, at 2 years old, which you should know because that's the age that you would toilet train. Physiological anorexia. So this is normal. This is basically a decrease in appetite that occurs with like 2-year-olds, 3-year-olds, the toddler stage. So this is completely normal. What you want to do is you want to provide them multiple food choices, set a scheduled meals, don't have TV while eating so that they're looking at the TV and not eating, etc. But don't force them to eat. Don't force something down them. Okay, so now we go on to Erik Erikson's psychosocial development. So this also I would just memorize If you want hints and tips on how to memorize either the growth chart or this, you can message me and I can make a video on that. But this is just the chart, and pretty much I would just memorize it. Okay, question. A maternity nurse is providing instruction to a new mom regarding the psychosocial development of a newborn infant. So using the ERIC and psychosocial developmental theory, the nurse would instruct the mom to. So number 1, allow the newborn infant to signal a need, anticipate all the needs of the newborn infant, avoid the newborn infant during the first 10 minutes of crying, and attend to the newborn infant immediately when crying. So even if you can't really remember the stage and the theory, you could just really weave out the correct answer just based on looking at these answers. You know, obviously, like they don't want you to avoid the baby within the first 10 minutes, etc. So the answer is allow the newborn infant to signal a need because it's going to allow the trust versus mistrust. It's going to allow them to gain trust. Okay, congenital heart anomalies. So congenital means that it was present at birth. They were born like that. Heart anomaly, so like defects. So the first one is tetralogy of flow. So the name tetralogy, tetra is 4. So there are 4 defects that are included in this. They're listed here. I have seen them asked a few times, so I probably would know that. That includes pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect, and overriding aorta. What I would know for tetralogy of Fallot is that they have hypercyanotic episodes, which are called TET spells. They usually occur when the baby's like crying or feeding, so they have even less oxygen getting in. And if this does occur, you want to put the baby in knee to chest position or squatting, and then apply oxygen. The treatment for this is really surgery. That's the only treatment. The next, so like I kind of just put down the main points that if you want to just memorize a few points, like you see over here, these 4, and the TET spells, if you have to memorize two stuff from that. The next one is transportation of the great vessels. As you see in the picture over here, you have the two, you have the aorta and the pulmonary artery, and in transportation of the great vessels, they are switched. So basically, like I just said, the arteries are switched. It's an emergency. For treatment, you give initial treatment is the prostaglandin E. It keeps the ductus open, and then surgery. For this, the main symptom is going to be cyanosis because most heart defects are going to cause cyanotic because oxygen is not getting around to the tissue like it should. The next one is atrial septal defect. So like the name says, there's a defect or an abnormal opening between the right and the left atrium. And so there's more pressure in the left atrium, then oxygenated blood flows from the left to the right. And basically it just keeps going. It's like osmosis, it just keeps going back and forth. And that's why if you listen, you could hear a systolic murmur. So that's what I would know. Atrial septal defect, systolic murmur. Or if it says like a murmur, just pick that one. The next one is ventricular septal defect, the same thing, just in the ventricle. So there's an opening in the spectrum between the ventricles. So like before, if there's more pressure on one side, the blood's going to flow, and you're going to hear a murmur also. Okay. So you're going to hear a harsh murmur, and yeah, they both have open septums and blood flows freely, like I said. So, okay, so now we move on to more heart anomalies that people are born with. The next one is coarctation of the aorta. So this is kind of like if you see in this picture over here, it's a narrowing of part of the aorta. So think of like a hose. You have a hose, if you kind of kink it, it's going to be like exactly like that. The main symptom that's going to clue you into this is going to be differences in the blood pressure. So the upper extremities will have a strong bounding pulse because they're getting a lot of oxygen and stuff like that. But the lower extremities, because it's kinked or narrowing, will have like a weak or absent pulse. So the treatment for that is a stent. They open it up, and then the patient's good. So just know for that, differences in the blood pressure. Okay, the next one is patent ductus arteriosus. So the ductus arteriosus is actually a blood vessel that connects the aorta and the pulmonary artery. It's supposed to close right after birth, and if it doesn't, it's patent. So that's where this comes from. And this leads to oxygenated blood mixing with the deoxygenated blood. The main thing I would know from this is machine-like murmur. That's what you're going to hear. Just know machine-like murmur, patent ductus arteriosus. Usually it actually closes itself, so if it doesn't resolve on its own, then you need intervention, but usually it resolves on its own. Okay, the next one, as you see, there's a pulmonic stenosis and the mitral stenosis. So stenosis is narrowing, so one is of the pulmonary valve and one is the mitral valve. So if you know your anatomy, you know where everything is, then you'll know like the symptoms. So the pulmonary valve, like it blocks the blood flow from the right ventricle, so you're going to have increased pressure on the right side. So like I would just know that the pulmonary stenosis, you're going to have a systolic murmur. The mitral stenosis, you're going to have a diastolic murmur. That's basically what I would know. Okay, so congenital anomalies. So these are just ones that are not cardiac specific, but they're just that people are born with. So trisomy 21. So this is Down syndrome. It's basically a chromosomal abnormality that the baby is born with 3 copies of the 21 chromosome and not 2. There's a lot of risk factors like giving birth over 35 is the main one, and symptoms. So I would know the symptoms because I like to test on it. So here's a picture of one symptom. As you see, like the toe, there's like a space between the toe. Some other ones, I'll just read them off to you, are flattened facial appearance, epicanthal folds, almond-shaped eyes, brush-filled spots, single palm, so they have like one crease on the palm, just one, short neck with excess fat, or skin more like, and small ears that are set low on the head. And like the picture shows is a gap between the 2 toes. You should just know with trisomy 21 that cardiac like problems are quite common, and there's no cure for it. The next one is trisomy 18. So there's also a chromosomal abnormality, which the baby is born with 3 copies, but just at the chromosome 18, not the 21. This is known as Edwards syndrome. This actually affects like all the organs, and basically the babies usually die in utero, and if they are born, they usually die within the first year. So there's no cure or treatment, but that's that. Okay, a question. So the assessment that would lead the nurse to suspect that a newborn infant had ventricular septal defect is. So basically it's asking you which symptom is goes with ventricular septal defect. Is it a loud harsh murmur with a systolic tremor, cyanosis while crying, the blood pressure is high in one arm and in the legs, or machinery-like murmur? So it's the last one, a loud harsh murmur. Okay, so now we go on to more congenital anomalies. So a cleft palate. As you see in this picture over here, this is actually a pretty bad one, but some of them are just minor and some of them are worse. What we have to know about this is that basically it's a cleft, so it's an opening in the mouth due to an incomplete fusion. The thing that I would know about this is that it's really difficult for the baby to feed, and so they're at risk for not enough nutrients and for aspiration. So usually they have surgery, but they don't have surgery right away. It's usually between 6 to 24 months. So until that is repaired, you have to, patient education and prepare them. So what you want to tell the mom to do is burp them very often, hold them in an upright position. They should be using these special bottles, a special nipple for the bottle that includes like a preemie nipple and stuff that are easier to be fed. And they should be fed often and not so much at once so that it doesn't tire the baby out. Post-op surgery, once they do have surgery, which is 6 to 24 months, they'll have pain management and the baby should be placed in upright position again. And you should know that because it's a surgery on the mouth, they shouldn't place any like pacifiers or tongue depressors or stuff like that in the mouth post-op. Okay, developmental dysplasia of the hip, DDH. So this is a hip abnormality that could be presented at birth, but it could also come within the first few years of life, or that they notice in the first few years. So what I know about this is the symptom is that the leg is with a dislocated hip. It may look a little shorter and turned out. The way you would diagnose it is what you have to know. So the Barlow's and Ortolani maneuver is basically the Barlow's, as you see in the picture over here, is when you adduct the hip while pressing down at the knee, and the Ortolani's, as you see over here, you flex the knee and hip 90 degrees, and you put pressure on the greater trochanters, just like the guy's doing over here, and you abduct the thigh. So those are just ways to diagnose the DDH. You should know the pelvic harness, as you see over here in the picture. This is it's not really a treatment, but it helps. It's used for 3 to 5 months, and what you want to know for this is that because it's put on a patient, so you have to assess the skin regularly. You want to dress the patient in a shirt and knee socks under the harness, so it shouldn't just be directly on the skin. But don't put any lotion or any powder under it. And you want to put diaper underneath the straps, and it is worn all the time. But you can remove it for a bath, etc., or a diaper change, but it's worn pretty much throughout the day. Okay, so here are more congenital anomalies. So spinal bifida. So that's basically a neural tube defect that occurs when the vertebrae of the spine, it doesn't close. So there's a wide spectrum. So the most mildest form is spinal bifida occulta, and they could have no symptoms, just a small little nevus or dimple at the base of the spine, or they could have a really severe form, which is the open spinal bifida, is when, as you see in this picture over here, the spinal cord is coming through and it's open. And the main thing you want to watch out for this one is infection, because it's open and it's out and the skin's not protecting it. So your priority is to cover the area with a sterile, moist dressing until surgery and put them prone. The next one is cerebral palsy. So that's actually a group of permanent movement disorders. And basically how you would detect this or screen for this is when they don't meet their milestones. So the baby's not crawling, walking, etc. The treatment is going to be PT, OT, rest periods, and medication like muscle relaxants like baclofen, etc. Okay, so these are GI disorders. Pyloric stenosis, it's basically when, as you see over here, there's a narrowing because you see this valve over here between the stomach and the small intestines, so it gets very thick and narrow. And as you see over here, there's hardly any room for the food to get into the small intestines. So what's going to happen is it's going to go up. It's going to go right back up. So they're going to have non-biliary vomiting. It's going to be projectile vomiting, like projectile. And it's going to happen after eating. They're also going to have an olive-shaped mass that you could palpate in the right upper quadrant. They're constantly going to be hungry because it's not going through. And they're going to be dehydrated. The treatment for that is surgery. So for all these stuff, like I said before, you just want to know, obviously it's good to know the pathophysiology and everything else like that, but if you had to key on one thing to memorize, I would know what's written over here, like the non-biliary vomiting, the olive-shaped mass, etc. The next one is Hirschsprung disease, which is also called megacolon. It's basically when a section of the large intestines is missing the nerve. So there's no movement because the nerve is missing or not working. So basically the stools cannot be passed. So they're going to have symptoms of someone who's backed up. Their abdomen is going to be very distended. They're not going to pass the meconium because meconium is a stool, so they're not going to pass the first stool, which is going to be the key giveaway. Very difficulty feeding. When they vomit, it's going to be green from the biliary, not like the pyloric stenosis, which was not because it didn't go through, and ribbon-like stool. So it's like someone who's like severely constipated like that. Okay, the next one is intussusception. So these are basically, as you see over here, it's like a telescope. So it's like when one part of intestines prolapse and telescopes into other part, as you see over here. So basically it's blocking the passage of the intestines contents and interrupts the blood supply, which could lead to ischemia. So it's actually an emergency. Anything that could lead to ischemia is an emergency, and you're going to have symptoms of colicky, abdominal pain, blood, current, stool, sausage-shaped mass. The treatment for that is actually the same thing you would use to diagnose them, which is an enema, ear enema. Question: which of the following assessment findings would the nurse most expect in a child who has been diagnosed with having hypertrophic pyloric stenosis? Current jelly stool and impalpable hard mass in the right upper quadrant, projectile vomiting and hunger after eating, weight loss and bloody diarrhea, or severe crampy abdominal pain and lethargy. So I'll give you a minute. Okay, so the answer is projectile vomiting and hunger after, because very little is getting through, so it's going to come right back up and they're going to still be hungry. Okay, so here are GI disorders that are very common in kids. So rotavirus, this is very, very common. This is very contagious. It's a viral illness, and the main thing you want to know about this is it's spread fecal-oral. So when I say fecal-oral, think about kids sharing toys, their diapers, they stick their hand in the diaper, and the main symptom that they're going to have is severe diarrhea, like watery diarrhea for a few days. So for this, you're going to watch out for dehydration, wash your hands, get vaccinated because there is a vaccine against it, and just watch them for dehydration. The next one is hyperbilirubinemia. So this is when they have too much bilirubin in the baby's blood. So it's kind of like the same symptom as too much bilirubin anywhere. You're going to have yellowing of the skin. Is going to be the main giveaway. The treatment for that is a phototherapy. So you should just know that it's going to place the newborn under a light and with only the diaper on. So no lotions, no ointment, no etc. And you want to only remove them to feed and put them back in. But they're going to need to be hydrated. And you don't want it to be too hot, obviously. The next one is appendicitis. So appendicitis is inflammation of the appendix. It could be from like obstruction or trauma. The main symptom they're going to have is the right lower quadrant pain, because that's where the appendix is. Tenderness at McBurney's point when pressure is applied there, and rebound tenderness. They're also going to have a white blood cell count. And the inflammation of the appendix, it could cause swelling and ischemia. And if it's not treated, the appendix could rupture and release bacteria. So what they do is they do surgery to remove it and prevent this. Okay. The next one is necrotizing enterocolitis. So this is when bacteria enters the bowel and it causes inflammation and basically just destroys the bowel pretty much. This is seen in preemies, you should just know, because their GI system is immature. So they're going to be given antibiotics, nothing by mouth, NG tube, etc. Okay, celiac disease. Celiac disease is an autoimmune disorder, and basically the patient can't eat any glucose because if they do, it will damage their small intestines, like the villi will. So what you do is that you don't have them eat any gluten. So a mnemonic for that is like no brow. So brow, no barley, rye, oats, or wheat. You should know what they could eat because they'll ask you like a question. So like a celiac disease patient, could they have like rice? So like just know the main ones that they ask. So you could have rice, you could have potatoes, and you could have corn. They should know that this will be like a lifelong thing. They'll be on a gluten-free diet for the rest of their life. And because they're going to be on that, you want to replace whatever, vitamins they're deficient in. Okay, a question. So a nurse is teaching the parent of a school-age child who has celiac disease. So which of the following foods selected by the parent indicates an understanding of the teaching? So number one, corn tortilla with black beans, pizza, canned soup, or hot dogs. Okay, so as we said before, corn is okay. So, and we also said that gluten is found in the brow, so barley, rye, oats, and wheat. Okay, so now we go on to urinary system disorders that are common with kids. So a UTI, urinary tract infection. So this can happen anywhere in the urinary tract. It can happen in the kidney, the ureters, urethra, anywhere here. Basically bacteria that gets in. It's really common because, especially with little kids, because what they do is that they don't clean well, and they'll wear like their wet underwear or whatever they're wearing, and then when anything is a wet place, bacteria builds up and it causes a urinary tract infection. So you should know the symptoms. It's the symptoms of regular urinary tract infection, burning with urination, urinary frequency, cloudy, foul-smelling urine, suprapubic pain. They'll also, if it traveled up to the kidney, so it's called pyelonephritis, then they'll have CVA tenderness. So over here in this picture, you'll see their ribs, and over here is like a made-up landmark, and you bang on there, and you see if they have pain. Treatment for a UTI is going to be antibiotics. Okay, hypospadias. So basically, it's a congenital defect that the urethral opening is under the penis, like on the underside of the penis. It's corrected by 6 to 12 months by surgery, and you want to push off the circumcision. The next one for the urinary disorders are nocturnal enuresis. So basically, this is bedwetting. But when I say bedwetting, it's talking about a person who's not like being trained, not like a toddler who's 18 months or something like that. It's someone who's bedwetting at an age where they should already be able to control their bladder and they have already been toilet trained. So what you want to do for this baby or kid more like is you never want to punish them, only positive reinforcement. You want to restrict to small sips after dinner so they don't just keep getting up and peeing, and have them void before bed. You can even have like an alarm clock that tells them to go to the bathroom, but no diapers, no training pants, or anything else like that. Okay. Okay, so here we go through the last part of the urinary disorders, which is basically nephrotic syndrome and glomerulonephritis. So they're very common, so I made like a chart over here so you could see the differences and compare and contrast. So nephrotic syndrome is when the glomerulus is changing and it leaks a lot of protein into the urine. Glomerulonephritis is when the glomerulus, which is also part of the kidney, is inflamed and causes red blood cells and a little bit of protein to be leaked. So the main difference over there is that nephrotic syndrome is a lot, like think of the O by nephrotic, and glomerulonephritis is a little bit of protein. So nephrotic syndrome is usually after a viral infection and occurs to like 2 to 5-year-olds, and glomerulonephritis is usually 14 days after a strep infection. So you'll see like in the question, I'll tell you like baby had a strep infection or whatever, kid has strep infection. So then you would think, and has a little bit of urine, you would think the glomerulonephritis. So symptoms, like I said, is either a lot of urine or a little of urine, edema. They'll also have tea-colored urine with the glomerulonephritis. Intervention. So for the nephrotic syndrome, you want to have the diuretics, restrict sodium, steroids, etc. For the glomerulonephritis, you want to monitor the blood pressure and you want to limit the sodium. Okay, so now we go on to the respiratory disorders. So tonsillitis, this is very common. So as you see over here, basically tonsils are graded, grade 1, grade 2, grade 3, grade 4. As you go up, there's a risk for, airway compromise because the breath have to get in there. So tonsillitis is itis, inflammation of the tonsils. It's usually caused by a viral or bacterial infection, and usually the symptoms they'll have is like pain during swallowing, and when you look inside, you'll see like a red swollen tonsils. Treatment is going to be supported if it's a virus, antibiotics if it's a bacteria, and if this keeps happening, then a tonsillectomy where they take the tonsils out could be done. If they do have a tonsillectomy, they're at risk for bleeding afterwards, and for that reason, you shouldn't give them any red ices or something like that, where you can't tell if it's blood or if it's from the ices. Okay, peritonsillar abscess is when the pus accumulates, forming an abscess in the throat, which is right next to the tonsils. So for the symptoms for that, the main one that's going to clue you into it is going to be hot potato, like a muffled voice. Okay, so here are 3 very common respiratory disorders: croup, RSV, and bronchiolitis. So that's why I put it in a chart where you could compare and contrast. So croup is a virus that causes inflammation of the larynx. Symptoms of croup are very specific. You'll have a barky cough. It's very distinct. You could Google croup-like cough and you'll hear it, and once you hear it, you probably won't forget it. It'll also give you a hoarse voice and difficulty breathing. RSV is a virus that causes infection of the respiratory tract. The symptoms are very different: fever, cough, but not like a barky cough, wheezing, and rapid breathing. So the last one is bronchiolitis. It's a virus that causes inflammation of the bronchioles, which are the small air passages. They're going to have symptoms of runny nose, cough, wheezing, difficulty breathing. The treatment for all of them are going to be the same. They're all viruses. Viruses are basically symptomatic treatment. So it's going to be humidifier, fluids, which is like water, drinking, hot steam, Tylenol, the bulb suction syringe if they have a lot of stuff in their nose. Okay, a question. The nurse should assess a child who has a tonsillectomy for frequent swallowing, inspiratory stridor, rhonchi, or elevated white blood cell count. I'm going to give you a few minutes. I forgot to mention this, so it's a good thing that I added this as a question. Okay, so frequent swallowing. So like I said, that tonsillitis, if you have a tonsillectomy, you want to watch out for bleeding. So frequent swallowing is an indication that there could be postoperative bleeding. Okay, respiratory disorders. So now we go on to cystic fibrosis. So what cystic fibrosis is that it's basically that there's a mutation between the transportation of sodium and chloride gene, and what it causes is thickened, sticky secretions. So these secretions, they're thick, like I said, and they're sticky, and they build up. So it could lead to a chronic cough. They feel like they can never clear their airways. What you want to do for this is you want to help them. So you want to give them a bronchodilator to open the airway, chest, physiotherapy to get the secretions out. If they're not eating, treat that, etc. There's no cure for this, and they usually live till around 30ish. Okay, esophageal atresia, which is tracheoesophagus fistula. So basically what happens in here is that the esophagus and the trachea do not properly separate in womb, and they're connected. So the symptoms you're going to have just think about where this is all located. You're going to have excess frothy sputum, coughing, drooling, cyanosis, and there's a risk for aspiration there, and the treatment is surgery. And the last respiratory disorder is epiglottitis. So epiglottitis is commonly asked on because it's an emergency. Basically, it's inflammation of the epiglottis, which causes life-threatening airway obstruction. It's an emergency, like I said. It's caused by a bacteria. They're going to start off with a really high fever, sore throat, and then the 4 Ds, I like to call them. D1 is drooling, D2 is dysphonia, so like a voice problem. These 3 is dysphagia, so difficulty swallowing, and distressed airways. What you should know for this is that never put anything in their mouth that increases anxiety because you don't want it to close anymore. So, for instance, if you could avoid it, try not to poke them with IVs and stuff like that. Yeah. The treatment is going to be like, first obviously take care of the airway, and then it's going to be antibiotics. Okay, so now we go on to neurosensory disorders. So meningitis is a big one. Meningitis is basically inflammation of the meninges of the brain and the spinal cord. It could be viral or bacterial, and that's important because bacteria is dangerous and viral is not so dangerous. The symptoms I would know also. Symptoms are fever, headache, nuchal rigidity, so the neck is rigid, photophobia, nausea, vomiting, and changes in mental status. Under 2-year-olds, the symptoms could be a little different. They'll still have the fever, but there'll be restlessness, like you can't get them to calm down, high-pitched cry, seizures, poor feeding, vomiting, bulging fontanelles, which are over here. They could also have a headache, nuchal rigidity, photophobia. They can even be altered. So the ways diagnosed is going to be a lumbar puncture. Before the lumbar puncture, you want them to have a CAT scan of the head because you cannot do lumbar puncture if they have increased intracranial pressure. So you want to rule that out first. You should also know about these 2 signs which could help you diagnose, which are Brudinsky sign and Kureg sign. And these will help you diagnose, and those are specific to meningitis. Treatment. So treatment is going to be, first of all, you want to isolate the patient. You want to put them on droplet precautions. Remember, droplet for meningitis. And you also want them to be on antibiotics, obviously, because if it's a bacterial infection, viral, it's not so dangerous, but if it's a bacterial, you want them to be on antibiotics. Other interventions, they should have like a low stimulation environment, seizure precautions, bed rest, and just monitor them. Okay. So next we go on to Ray's syndrome. This is actually very rare, but when it occurs, it's serious. That's why you should know it. It's a serious disease that causes swelling in the liver and brain that usually follows a viral infection. Symptoms are going to be fever, lethargy, encephalopathy, hepatic function altered, and elevated ammonia level. The main thing for this, because it's like shown as a risk factor, is don't give a child aspirin or something that's containing salicylic acid, so someone with a viral infection. The next one is febrile seizures. So this is a seizure in a child that's caused by a spike in temperature. So they'll have a really high temperature and then seize. It's usually from like an infection. What you want to do is the same thing as all seizure precautions, prevent them from self-injury, never leave them alone. You want to give them Tylenol prophylactically to control the fever, and cooling methods. So like, like a cool damp towel to the forehead or very little clothing on, like that. Okay, the next thing is a VP shunt. What I would just know about this, it's basically just monitor for infection. Just for your information, a VP shunt, it relieves pressure on the brain caused by like excess fluid. It's placed in the surgery, and you just want to monitor for infection. Question. Which of the following pediatrics patients is in need of immediate intervention? Protruding tongue and drooling at 5 years old, 10-year-old with obvious deformity of the right arm, nausea, vomiting, diarrhea, 13-year-old, and fussy 5-month-old. So obviously the answer is A, because whenever you think of drooling and like a protruding tongue, you want to think of epiglottitis, which is an emergency. Okay, neoplastic disorders. So this is just really one that I'm going to be talking about. Will's tumor, which is also called nephroblastoma. So this is actually a kidney tumor that's common and usually commonly found in like children under 5 years old. And it only occurs to one kidney. Once they're diagnosed with this, the main thing you want to know is do not palpate the stomach because it could rupture otherwise. So you want to post a sign near the bed, no touching the stomach and stuff like that. The treatment is surgery and chemo. Okay, infectious disorders. The first one, acute otitis media, which is an ear infection, really common in kids. It's infection of the middle ear, inflammation of the middle ear due to infection. It's usually in kids under 2. It could follow respiratory infection. And the reason why it's common in kids because their eustachian tubes are shorter, straighter, and horizontal. So symptoms for kids, they'll be like pulling or tugging at their ear, playing with their ear, or just saying they have ear pain. To prevent it, you want them to stop smoking, get immunized, no more pacifiers, etc. Otitis externa is also known as swimmer ears. It's an infection like the other one, but it's to the outer ears. Otitis media is to the middle ear. The symptoms are going to be ear pain that's worse when direct pressure is put on the tragus. Treatment's going to be like antibiotics, medication, etc. Okay, so more infectious disorders, so pinworm. So pinworms are basically small parasitic worms that live in the colon and the rectum. So symptoms they could be scratching the rectum a lot. They could have trouble sleeping, irritable. They don't really know what it's from. What happens is that when they scratch it, it could transfer from their fingers to other surfaces. So you really want to watch that. What you could do is something called a tape test, which is basically you place a piece of tape in the perianal area, and in the morning you remove it and you send it to the lab for testing. Treatment's going to be anti-parasitic medication. And you want to treat everybody. The next one is pediculosis capitis, which is known as head lice, as everyone knows it, or lice. It's very contagious. What you would see the patient be doing is like excessively scratching their scalp. They'll have white eggs, tiny little eggs on their hair shaft. What you have to do for this is remove the nits. You want to use a nick comb for 2 to 3 days for 2 weeks. You want to vacuum, make sure everything's out. Treatment for this is pediculicide, which is permethrin. Okay, question. A child is diagnosed with Wilms tumor and planning teaching interventions. What key points should the nurse emphasize to the parents? So number 1, do not put pressure on the abdomen. Number 2, frequent visits from friends and family will improve morale, or appropriate protective equipment should be worn, or encourage the child to remain active. So as we said, you never want to pressure the abdomen because you don't want it to rupture. Okay, so communicable diseases found in kids. So with kids, there's a lot of like memorization and stuff like this. So like I said, like before, know the key ones. Like what's going to stick out with this? Because they're not going to ask you like, what's the symptom of this? And they're going to say like nausea. It's not going to be that like that. It's going to be something that sticks out that's going to clue you to, oh, this is that. So over here, it's comparing all these communicable diseases. So varicella is also known as the chickenpox. The symptoms happen in 3 phases. First, they have a macula, then papules, then a vesicle, and then it crusts over. They're going to be an airborne and contact precaution, and they're going to get for treatment antipyretics, anti-inflammation, and pain meds. The next one is 5th disease. This is also called erythema infectious. So this main characteristic, it looks like a slap face. It looks like someone just like smacked right here and it's like all red right and then cheeks. It's transmitted through respiratory secretions and blood. The same treatment. You should know that it's caused by the parvovirus, and the main thing is it could be dangerous in pregnant women. Next one is mononucleus, so mono. Symptoms are going to be fatigue, sore throat, splenomegaly, fever, hepatomegaly, swollen lymph nodes. It's transmitted, it's called like the kissing disease because it's like transmitted through sharing drinks, kissing, saliva. The treatment is going to be the same thing, hydration, pain meds, reduce fever. The next one is pertussis, which is a whooping cough. The symptoms are going to be a violent spasmodic cough. Like, you could Google it. It's very distinct also. It's going to be transmitted. They're going to be on the droplet precautions and treatment, the same thing, like supportive, antibiotics, humidified oxygen, small, frequent fluids, and suction. The next one is measles. So measles is rubeola. The symptoms are going to be fever, runny nose, cough, sore throat. They're going to be on airborne precautions, and they're going to be resting and antipyretics. Okay, hematological disorders. So stuff has to do with the blood. Number one is sickle cell disease. So this is an inherited blood disorder where the red blood cells, they basically become sickle shaped. As you see in this picture over here, they're like moon sickle shape. So because of the way they are shaped is that they clump together and they obstruct the blood vessels, which is known as a sickle cell crisis. This occurs and causes a lot of pain. Like, the main symptom is going to be pain. It could be caused by dehydration, stress, or infection. What else do you have to know for this? That because it's sickle shaped, and so think of like less oxygen, so it's an emergency because you want to get help right away because it could lead to tissue damage and death. The treatment for this is fluids and pain medication. That's it. Fluid, pain medication, fluids, pain medication. The next one is hemophilia. That is a bleeding disorder, and basically they're not getting enough clotting factor. So clot prevents you from bleeding, so if they're not getting enough, they're going to have uncontrolled bleeding. So that's pretty much what you want to watch out for. They should also have like injury precautions, because if someone gets hurt and normally bleeds a little bit, it's fine, but these people who have hemophilia, they're missing the clotting, so they could bleed out potentially. So you want to talk to them about injury preventions, avoid contact sports, avoid IM injections, or rectal temperatures. Okay, musculoskeletal disorders. So scoliosis, as you see in this picture, it's a lateral because it's going to the side, curvature of the spine. It's screened at 10 to 14 years of age. And you should know it cannot be cured. It could just be prevented from getting worse. What you want to put on for them is like a back brace. So there's like a bunch of different ones that you could put on. Most teenagers, if this is like for a teenager, they won't really have it on because of their body image. So you want to discuss with them and talk to them and make like a common option. The next one is Duchenne muscular dystrophy. So this is an X-linked recessive disorder that causes severe muscle dystrophy. So basically the symptoms are going to start out on the voluntary muscles, so like think of your calves, etc. And they're going to progress to other muscles like the shoulder, respiratory muscles. The symptoms, you're going to have regular fatigue, enlarged calves. It depends if they work on that, walking on tiptoes, frequently falling, and grower sign. So grower sign is basically hips on the thighs to push up. Treatment, there's really no effective cure. They're just usually bedbound and die at like 30 or 20 from respiratory failure. Okay, question. So the school nurse knows that the child has a rash and suspects it's caused by erythema infectious. So the nurse makes this determination that the rash results in which parents. So like I said, what was like the key thing that stood out? So that would be the slap face parents. So that's 4. Okay, so here are just other disorders that are very common in the pediatric population. So number 1, strep throat. This is usually due to a bacterial throat infection and it's very contagious. So the treatment for this is antibiotics and supportive, like Tylenol when needed, etc. You want to tell them that they should complete all their antibiotics even if they feel better, and they should throw away their toothbrushes, etc. that was started with the strep, and they can return to school 24 hours after the start of antibiotics. The next one is Kawasaki disease. So this is inflammation of the medium-sized blood vessels. So I would know like the symptoms. It's kind of like stages. So basically they start off with a sudden high fever, does not respond to any medication or anything else like that. They're very irritable and swollen. Then they move on and their skin peels from the hands and the feet and they get very irritable. Then the last stage is the convalescence, which is that the symptoms slowly disappear. Treatment for this is IVIG, so IV gamma globulin, IVIG, and that's it. Okay, the next one is PKU. So PKU is basically a genetic disorder in which a person lacks the enzyme phenylalanine. Treatment for this is going to be a low phenylalanine diet, and you should monitor their levels. The next one is hydrocephalus. So this is basically a type of swelling in the scrotum in which the fluid fills around the testes. Most cases usually resolve on its own, but if not, then surgery, but not an emergency. The next one is circumcision. So this is just like patient education. Is that basically post-op, the penis is going to be dark red, and after 24 hours, it will be a little yellow exudate on it, red and swollen. When you're changing the diaper, you want to put petroleum jelly to prevent it from sticking, and it should not be loose. If they bleed more than the size of a quarter, then it's a concern, otherwise it's not. Okay, so other disorders that are common when with kids is number 1, fecal incontinence. So this is basically bedwetting, but instead of with urine, it's with stools. So the major symptom, you're going to see their underwear is going to be dirty. For this one, you want to watch out. You don't want to scream at them. You don't want to punish them and make them hold it in and not go. Some common causes of this are constipation or psychosocial triggers. You want to treat it by relieving the constipation and then dietary changes, so more fiber and behavior modifications, so regular toileting, scheduling time, etc. The next one is lead poisoning. So lead is commonly found in houses, but the main key that were made before 1978. So that's going to be our year you want to remember. You want to screen kids are screened for lead poisoning between 1 to 2 years old. Lead could affect the brain, and over 5 is pretty dangerous. Treatment is chelation therapy. The next one is toddlers. So here's just information about just toddlers that you should know. Number 1, they should get nutrition-dense food. Number 2, don't give them food that have the potential for foodborne illnesses, so like raw, uncooked foods. Number 3, don't give them like small, hard, rubbery food like hot dogs that they could choke on. And you want to give them food choices if possible. And you want to continue their home routine as much as possible so that they could be structured, etc. And lastly, school-age children. So what you should know over here is that when you're giving them an injection, you want to use appropriate language. So say I'm putting medication under their skin. Don't say oh, I'm not doing anything, and then do it, because you don't want to lose their trust. You also want to improve their control. So you could have them help you, etc. Okay, question. So the nurse is caring for a child with a diagnosis of Kawasaki disease. The child's parent is asking the nurse, how does it affect my child's heart and blood vessels? The nurse responds based on the understanding that inflammation weakens the blood vessels, increase lipid levels leading to the development of atherosclerosis, untreated diseases causing mitral valve stenosis, or altered blood flow. So A, inflammation of the vessels that weaken the walls of the vessels and often result in aneurysm. So thank you so much for watching. If you want any of this or all of this in a PDF form, you could get it at my website, sarahrn.com. That's SARAHRN.com. And please like, subscribe, and put in the comment section if you have any questions, or email me. Thank you.